From Brazil, which compared three arms. Children who were failing to thrive were either stimulated alone, or fed and stimulated. Importantly, what it showed is that children that were stimulated alone did better than children that were fed alone. So it again shows kids need to be stimulated to grow. It's not just a matter of feeding them. If kids aren't being stimulated, they're not being loved, if they're not being cuddled, if they're not being cared for, even if they're being fed, they won't develop normally. This is an important study which shows that they compared children from three groups of families. Children in families where parents had university degrees, children in families where parents were working class, and children in families where parents were welfare recipients. And if you compare the university families to the welfare recipients, by age 4, children have been exposed to 32 million more words, and words that were more complex and of different tones, and all of that promotes brain development. As well as that, children in the university families have had 560,000 more positive affirmations than negative affirmations. Children in the welfare families have had 160,000 more negative affirmations than positive. So you can see from this study a very different pattern in what's happening to kids. They're being taught, their conversational language is vital for brain development. If you've got the television on and kids are under 2, even if conversation's going on, they won't hear it. It's got nothing to do with pussy ears. Pussy ears is not the major reason for this lack of brain development. Pussy ears themselves does not knock off enough hearing to make a difference to this. It's lack of language, it's lack of conversation, it's the television being on, kids being put in front of the television, kids being left there while parents are doing other things, often addicted to gambling, alcohol and other things. And so this is what's leading to this problem, and it can be addressed in a number of ways. I want to focus on the home visitation program and educational daycare. The home visitation program is something that Congress runs. It's not being run anywhere else, but basically it's based on the Olds model. He did 3 randomised controlled trials in America in 3 different places amongst low-income first-time mothers mainly, amongst very poor communities, situations where you had overcrowding, domestic violence, all the same sorts of problems that we have. And he basically showed if you follow these children up, the intervention goes from pregnancy, and in fact it has to be prior to the 28-week point of pregnancy, till when the child's 2. And a home visitor, a nurse, not any, he compared other allied health professions and others, but it turned out to be a nurse that was best, visits and maintains a relationship over 2.5 years with that family, and visits almost every week. And when you follow those kids up at age 15, these are the outcomes. They're 80 to 90% less likely to be in trouble with the police, much less likely to have addictions, much less likely to have STIs and sexual partners and to be pregnant. The sort of things that we know follow on from a bad early childhood can be partly addressed. This is the best parenting support program in the literature. And FACSI are funding a whole heap of parenting support programs. They're not funding this. And the programs they're funding don't have anything like the outcomes that this has. Congress is running it. It's going really well. The nurses in the program love it. We've got great retention. There's a good acceptance rate, and we're getting really good evidence of success. But unfortunately, this program's going nowhere at the moment. Government have decided it's too expensive, and they've actually even stopped the evaluation so that we're going to evaluate ourselves, because we've got a hell of a lot of data that hasn't been looked at yet, and we need to demonstrate just how effective it is, because it's only happening in 3 sites around Australia, and it was meant to be happening by now in about 30 sites. But I think it's a really important program. It's one of the things that we need to do to support parents and to support families so that they know what responsive care means and how to do it best with their kids. There are 6 domain areas in the program: personal health, environmental health, life course development, maternal role, family and housing, health and human services. The nurse in each visit, depending on the age of the child, has to spend a certain amount of time. It's very prescribed in each of those domain areas. It's not just about, the nurses do nothing in terms of treatment. That's absolutely not part of the program. They just ensure mothers and families know how to access care, and they ensure they know about health and the importance of breastfeeding, the importance of reading to kids and all the sort of things. What the good parenting story I was telling before, that's what this program's about. Making sure parents know all about that, and not having the telly on and things like that, and talking to kids, and that's what that program's about. We've got 100 families, 100 mothers on that program in Alice at the moment, and it's reached a steady state level. It looks like that's about where it's going to stay. and it's achieving already very good things in terms of reduced smoking rates in pregnancy, better health status in kids, and we're just analysing the data now to look at child development outcomes. It's the most cost-effective program of any program known in terms of this area, whether it's all the other parenting, they compared all the other parenting programs, they compared youth substance misuse programs, youth programs. This gives you the greatest return in terms of the investment, but there is a significant upfront investment. And this is what governments don't like. It's a 15-year wait before you get return, and it's a significant upfront investment. That's why it's been a hard sell. But over the long term, not even that long, I've been around 25 years now, 15 years is not a long time to wait to see some significant improvements. But that's the sort of time phase that's needed.